Hi students, three important cases from carbohydrate metabolism, clinical scenarios. First one is von Gierke disease, second one is galactosemia, third one is lactose intolerance. Von Gierke disease, the enzyme defect is glucose 6 phosphatase. So because of the deficiency of this enzyme, the available glycogen is not able to convert it into glucose. That is the logic for glycogen storage disease, that is von Gierke disease. Okay. In your clinical scenario, the clinching points for your diagnosis is baby is 1 to 5 years old baby, always coming with a distended abdomen because of the accumulation of glycogen in liver produces hepatomegaly. Then patient is having developmental delay and always looking the baby is lethargic or sluggishness baby. The three important biochemical parameters or biochemical points for the von Gierke disease is number one, hypoglycemia, that to fasting hypoglycemia. Second one is that is our glucose value always less than 50 milligram per deciliter. Second one is lactic acidosis. Because of the enzyme deficiency, the available glucose is converted into lactate. So the baby will go for lactic acidosis. The next one is most of the glycogen enters into HMP shunt pathway and produces more amount of pentose sugar. So the patient is having hyperuricemia. You know the pentose sugar means purine and pyrimidine, which will be converted into uric acid. So the patient is having hyperuricemia. These are all the points for your von Gierke disease. Next one is galactosemia. Here the enzyme problem is galactose 1-phosphate uridyl transferase. In galactosemia, the triad is mental retardation, hepatomegaly and aminoaciduria. All the amino acids will get excreted by kidneys. So kidney, liver, brain, all the three organs are important points for your galactosemia. So in your clinical scenario, the clinching points for your diagnosis is congenital cataract due to the accumulation of dulcitol or galactitol. Jaundice is there and galactose present in both urine and blood. This is your clinical presentation picture. Next one is lactose intolerance. This is also affects the babies only. Actually, the babies are coming to the hospital after ingestion of dairy products, milk items like products. After that, they will go for diarrhea as well as abdominal pain. Whatever food you give, they will go for vomiting as well as abdomen pain. Sometimes in your clinical scenario, they will give stool is positive for galactose. That indicates, stool is positive